I'm Nancy Burley. In the spring of 2012, I spent a week at St. Pat's with a very bad bout of pneumonia in my left lung. Shortly thereafter, I was diagnosed with non-small cell cancer in the lower lobe of my right lung. A big shock, as I am not and have never been a smoker. After consulting with my pulmonary doctor, I made an appointment to see Dr. Muse, a cardiothoracic surgeon. I knew immediately that he was the doctor that I wanted to do my surgery. I knew his surgical skills were excellent, and I came to know that his caring and his compassion for his patients was also excellent. Because of the many prayers that were said on my behalf, the surgical skills of Dr. Muse, and the outstanding care that I received from everyone at St. Pat's, I am happy to say that I am cancer-free. Staying at home was the absolute best decision for me.
I remember it well, 2:07 a.m. Friday morning, December 1st, 2011, just a little over 3 years ago. I woke up with the most severe chest pain I'd ever had. Within an hour, I was in the St. Patrick's emergency room. Dr. John Burton and the team were looking after me, and just a few minutes later, Dr. Thomas Mulhern arrived. I don't remember much after that until about 8 o'clock in the morning, when I learned that Dr. Mulhern had taken me to the cath lab for a small heart attack and had opened up an obstructed vessel by the placement of a stent. A couple of days later, I was gone. 2 weeks later, I was back to work. And all of that because I was able to stay here at home and have care done in this region rather than having to go to some other city where the loss of time and therefore muscle might have precluded me from having the kind of recovery that I've had. I ask each of you today to join me in making a small gift to our hospital so that we can ensure that the next 40 years will be as good as the last 40 years have been relative to the care of our cardiac patients. A small gift will ensure that we can continue to provide that same quality of service and to keep that service local rather than having to send it elsewhere. Thank you. God bless each of you, and God bless CHRISTUS St. Patrick's Hospital.
Good morning. I'm Don Lloyd, Chief Executive Officer of CHRISTUS St. Patrick Hospital. First, let me apologize for not being with you this morning. As you know, we have some very exciting strategic initiatives underway, and unfortunately, I am participating in those discussions off campus. Second, let me thank you for taking time out of your busy day to be with us here at these forums. We will be as respectful of your time as we possibly can, but we have some very exciting news to share with you. Third, let me give you an update on where we stand today with our capital initiatives. When we launched this campaign some 18 months ago, we pledged to you and to our community that we would invest $12 million in 3 clinical service areas. First, neurosurgery. Second, cardiovascular services. And third, oncology. It is incredibly important that we, as leaders and as associates and as members of the medical staff, bring the technologies that are necessary to enhance not only patient care, but to attract the best and the brightest talent, and for you in this room to retain the best and the brightest talent so that you know that you have the best possible clinical resources. I'm pleased to report to you that as of this morning, we have invested some $7.5 million in these 3 major capital initiatives. We had initially established in our $12 million goal, $6 million that we would raise through local philanthropy and through the generous support of our foundation. With your help, we can accomplish this goal. We have raised some $3.5 million of our $6 million goal. Now, you may ask, well, how did we spend $7.5 million thus far? Our corporate parent, CHRISTUS Health and CHRISTUS Health Louisiana, have contributed substantially, as well as the CHRISTUS St. Patrick Foundation. That is why we have already been able to retool our neurosurgical services, replace our first cath lab, and we have recently ordered a 128 slice CT scanner. In addition, we've invested almost $5 million in our oncology program. And through your efforts, we can do more. So I ask each of you that are here today, in some way, we ask that you consider supporting this campaign. We ask for your support not only through financial contribution, but also through your support of opening doors for us in the community. We hope to wrap this campaign up by the fall. We are confident that we will be successful, and we ask for your continued blessings as we take this path together. May God richly bless each and every one of you.
As the chairman of the Cancer Committee, and through attending Tumor Board and participating in Tumor Board, I see the need that our community has to have updated, upgraded, quality, state-of-the-art cancer care here in Lake Charles, and specifically at St. Pat's. It's through our work with the Cancer Committee, we keep statistics and through Tumor Board, and we can see that approximately 50% of our patients who are diagnosed here at St. Pat's either seek an opinion elsewhere or get at least part of their treatment elsewhere. And it seems that there's a perception that the only way to get quality cancer care is to go out of town, especially since we have Houston nearby. And we can change that perception in the community. It's very hard on a cancer patient to have to travel out of town to get their treatment. I know because I'm a cancer survivor. About 6 years ago, I was diagnosed with ovarian cancer. And for treatment of ovarian cancer, to see a gynecologic oncologist, you often have to go out of town. And so I did, and I will say that was very hard to not be able to stay in town and receive treatment here. Traveling is hard on the patient, going back and forth, feeling that the people that are providing their care are not at their fingertips. It adds to the stress of cancer patients. And with the improvements that we can make here at St. Patrick Hospital, in the Cancer Center, in radiation oncology, we can bring healthcare and hope right here at home.
In early October of this past year, I came to work and had thought I was doing relatively well. My staff, on the other hand, recognized that I was having some significant problems where I couldn't speak and my words were coming out garbled. They immediately contacted one of the physicians in our department, and he came and talked to me, and through his swift recognition of what was going on, took me to the emergency room, where I underwent a number of tests, and it was determined that I was having a significant stroke. Was treated by all of our emergency staff and our cardiology team. They used a clot buster drug on me that eliminated the clot that was happening at the time, and I came through it without any deficit at all. And that's why it's very important for this campaign and for the dollars that you provide for our center. We're always in need of new equipment and new procedures in our department, and this funding that you provide for us helps us to take care of the next person.
I'm Julie Abate. I'm the chairperson for the Associate Giving Campaign. I'm part of this project because I was given the job as the family nurse to facilitate the care for my dad through 5 admissions at our hospital, which was fantastic care. However, the 6th admission was severe enough that they shipped us to another hospital out of town because our hospital did not provide those services. And that was very, very hard for me to take as the nurse and the facilitator of his care. They gave wonderful care, however, that was the last week of my dad's life. And we were out of town, living in a hotel down the road from the hospital. My family, my support system, my hospital family was not there to support me and my family through the worst time that I could have ever imagined. So if we would have had then the same services we have now, we all would have been able to stay home with our families. I would have been able to have my dad at the hospital where my support comes from. So as my question to you would be to give to this campaign, because it is very important when you and your loved ones want to have these services, for you to have this health care and hope here at home.